Mpox, formerly known as monkeypox, has been declared by the WHO as a public health emergency of international concern. 219 deaths have been reported by about 121 countries globally, according to the WHO. How do people get this? Primarily by contact with someone who is already infected, or an infected animal, and also it's sexually transmitted. Now, to give you a bit of background, there are two groups or two known clades, they're called clades, of this Mpox. There's clade 1 and there's clade 2. Clade 1 has been reported to cause more severe Mpox disease with higher case fatality rates. Clade 2 has been present with us in the UK since 2022. Clade 1 has never been identified in the UK, and the overall risk of clade 1 to the UK population is considered low. However, given the ongoing outbreaks, it's important to remain alert. What symptoms do people show when they have Mpox? They could have a skin rash or a pus-filled lesion which can last 2 to 4 weeks. They can also have fever, headaches, muscle aches, back pain, low energy, and swollen lymph nodes. So when someone has Mpox, they often have a flu-like illness before developing a blister-like rash. They are considered contagious until the rash has fully healed. So symptoms typically last 2 to 4 weeks, but may last longer in someone with a weakened immune system. So how do we test for it? The preferred sample is a swab of the rash. We can swab the rash. We can do a throat swab in someone who has symptoms but doesn't have a rash, okay? You might also have symptoms from your backside, your anus, in which case we can do a rectal swab. Now, if you have the rash, it's really important not to try and pop it or scratch at it, because when you do that, you can actually spread the virus to other parts of the body, and that will increase the chance of spreading the virus to other people and possibly cause the open lesions to become infected by bacteria. So if you have the rash, please leave it alone. Just keep the area clean, okay? So currently, there's no treatment approved specifically for the Mpox virus, okay? For most people with Mpox, that have an intact immune system and don't have a skin disease, you only need supportive care, and pain control will help you recover without medical treatment. Mpox is rarely fatal, and most cases will clear up on their own without treatment in a few weeks. However, in a few rare cases, Mpox can cause complications like pneumonia, brain infection, that's encephalitis, or eye disease, which may be deadly. So, whereas for most people it will be a mild flu-like illness, for a few others it can get complicated, okay? So, is there a vaccination for it? Yes, there's a vaccination, the same vaccination that was actually used for smallpox. But the issue is getting it around to where it's needed. So distribution remains a challenge. Countries affected include the Republic of Congo, Central African Republic, Burundi, Rwanda, Uganda, Kenya, Cameroon, and Gabon. But countries where there may be risks based on them sharing a border with Congo include Angola, South Sudan, Tanzania, and Zambia. So if you have recently traveled from any of those countries, or you've had contact with anyone who recently traveled from these countries, or you've been in contact with anyone with Mpox in the last 21 days, and you have symptoms mentioned, please speak to a doctor, really important, okay? So how do you prevent Mpox? You can avoid getting it by cleaning and disinfecting surfaces and objects. Cleaning your hands after touching surfaces and objects that may have been contaminated. Avoid handling clothes, sheets, blankets, and other material that have been in contact with an infected animal or person. Isolate people who have Mpox from healthy people. Wash your hands well with soap and water after any contact with an infected person or animal. Use condoms during sex. That will help reduce the risk of getting Mpox. It will not stop you getting it though from skin to skin or mouth to mouth contact. So the trending nature of Mpox signifies a need for vigilance and effective communication and swift action from health authorities to control its spread.